So good morning again, everybody. I'm going to introduce Brianna, and she is going to present on gastroparesis. And it's still our May 2022 in-service on gastroparesis. It's all you, Brianna.
Okay. Like Dr. Baldwin said, hi, my name is Brianna, and I'll be talking about gastroparesis and aging. So at the completion of our presentation, I hope that you all will be able to explain what gastroparesis is and the common signs, symptoms, and risk factors associated with it, and also describe the impact gastroparesis has on other common illnesses and also our daily eating habits. So first, we're just going to get into what exactly gastroparesis is. Gastroparesis is also known as delayed gastric emptying. Pretty much is just a disorder that slows down or completely stops the movement of food from our stomach to our small intestines. So normally when we eat and swallow our food, once it travels through, the muscles in the wall of our stomach are there to grind our food into smaller pieces and then push the food into the small intestines, just continuing our digestion process. But for people who have gastroparesis, they have stomach muscles that either don't work at all or work very poorly, so they're not able to fully push that food into their small intestines, and typically it just delays their overall digestion process. So I included this picture here just to further explain that. So as you see here on the left, this is just a normal healthy stomach. You eat your food, it travels through your esophagus. It's able to go through the stomach and push correctly into the small intestines. But here on the right, for a person who has gastroparesis, they eat the food, it travels through the esophagus, but the nerves in the stomach are damaged, so they're not able to push it through correctly. So as you can see, as noted here with the arrows, sometimes you might have food that travels back up into the esophagus. You can have food that just sits in your stomach for an extended period of time, causing nausea and bloating. And as the arrows here at the end, you see that it's not being pushed properly into the small intestines. So just for a little statistics, overall gastroparesis is not extremely common, or at least it's not diagnosed, but at least 1 out of 4 adults will experience symptoms similar to those of gastroparesis. And then 10 men and 40 women out of 100,000 population will be diagnosed with gastroparesis throughout their life. So the cause of gastroparesis is idiopathic, pretty much just meaning we don't know exactly what the root cause is. However, you're more likely to be diagnosed with gastroparesis if you have diabetes, prior surgery on your esophagus, your stomach, or small intestines, which just causes some injury to the vagus nerves in the stomach, or if you're undergoing any cancer treatments, in particular radiation treatments on your chest or stomach. So a few of the signs and symptoms of gastroparesis include heartburn, some nausea, vomiting, excessive bloating or belching, upper abdominal pain, feeling full soon after you ate your meal, or just having poor appetite overall. So a few of the risk factors associated with gastroparesis would just be diabetes, hypothyroidism, having abdominal or esophageal surgery, having any type of infections, taking certain medications, scleroderma, which is just having a connective tissue condition that causes some inflammation and can also infect your or affect your internal organs, including the stomach, having nervous system disorders such as MS or multiple sclerosis, or being a woman, you're more likely to experience gastroparesis. So a few of the complications of gastroparesis include dehydration, just from the frequent vomiting the patient may experience, overall malnutrition, just either from the lack of appetite or excessive vomiting, bacterial growth if you have food that's staying in your stomach for too long, BSARS, which is pretty much just having solid masses that form in your stomach from digested food. This can also lead to excessive nausea and vomiting, and also just having unpredictable blood sugar levels, which can be caused based from the lack of appetite or excessive vomiting. So when it comes to diagnosing gastroparesis, often it is misdiagnosed just because a lot of the symptoms can be seen with other common illnesses. So pretty much just to get an accurate diagnosis, the patient has to be presenting with the symptoms of gastroparesis, such as feeling very full after they eat, the nausea, the vomiting, the bloating, and the upper abdominal pain. They also have to have a documented delay in gastric emptying, and also an absence of gastric outlet obstruction or ulceration. When diagnosing, the physician will do a physical exam where they're gonna just check your blood pressure, your temperature, heart rate, check for any signs of dehydration or malnutrition, and also check your abdomen for any unusual sounds, tenderness, or excessive pain. So a few of the things that can make gastroparesis worse, you can have or be taking certain medications that affect the overall motility or just delay gastric emptying, such as taking certain narcotics like codeine, hydrocodone, morphine, and oxycodone. Also certain antidepressants like amitriptyline, nortriptyline, and venlafaxine, anticholinergic medications, which would just be our diphenhydramine or Benadryl, oxybutynin and olanzapine, and also medications that treat overactive bladder. Having eating disorders such as anorexia or bulimia can also make gastroparesis worse, and excessive alcohol, tobacco, or marijuana use can also do that. So now we're just gonna go into some of the treatment options for gastroparesis. It's not an illness that can be cured per se, but it can be controlled based on certain medications we have available. So the first one we have here is metoclopramide. Pretty much this medication just increases the tightening and contraction of our stomach muscles and just overall improves our gastric emptying process. It can also help with relieving any nausea and vomiting the patient may be experiencing. It comes in a few different formulations. So we do have an option to use a nasal spray. If we do that, it'll be one spray in one nostril 4 times a day, and you'll take that for 2 to 8 weeks with a max of 4 sprays per day. We also have oral, IM, IV, and sub-Q formulations. The dosing for that would be 5 to 10 milligrams, 2 to 3 times a day before meals. For this, we want to titrate to the lowest effective dose. You don't want the patient taking any more than they have to control the symptoms. The max dose for this would be 40 milligrams a day divided in 4 doses. Our oral method or the tablet formulation would be our preferred route of administration. And some of the common side effects include drowsiness, headache, dizziness, nausea, and vomiting. Some of the other medications that we can use for gastroparesis would be erythromycin. This pretty much just increases our stomach muscles to contract properly and improve the gastric emptying process. This comes in an IV formulation where we would prescribe 3 milligrams per kilograms. That would be administered over 45 minutes every 8 hours, or we can choose the oral option, which would be 250 milligrams 3 times a day before meals. Some of the common side effects of this would be tachycardia, chills, cough, and diarrhea. We can also describe or prescribe antidepressants such as mirtazapine. This is just pretty much used to relieve any nausea and vomiting the patient may be experiencing. And the dosing for this would be 15 milligrams by mouth every night. We also can prescribe antiemetics. Our prescription options would be ondansetron or promethazine, and then over the counter, we can take diphenhydramine or Benadryl. These medications are used to relieve the nausea and vomiting. If we choose to take the ondansetron, it would be 4 milligrams or 4 to 8 milligrams 3 times a day. For promethazine, we don't want to use this in older adults, so this isn't one we would typically see in our geriatric population. And lastly, the diphenhydramine comes in IV or oral. IV would obviously be prescription or in the hospital, and oral would be over the counter. And that would be 12.5 to 25 milligrams every 6 to 8 hours as needed. So if our patient is having some trouble eating properly or, the digestion of their food, we do have other feeding options that can assist with that. The first one would be oral or nasal tube feeding. So with this, a tube is placed into the patient's mouth or their nose. It travels through the esophagus, into the stomach, and through the small intestines. This just helps the patient receive the proper amount of nutrients or calories they need daily. Next, we would have gastrostomy tube feeding, which is just very similar to our oral or nasal tube feeding, but we can use this for a longer term. So a tube is placed directly into your small intestines, and it just allows liquid food to travel through. Lastly, we have parenteral nutrition, which is only used if the patient has very severe gastroparesis and the other treatment options aren't working. So with this option, the liquid nutrients or liquid food is delivered directly into the patient's bloodstream. So a few of the last line options we have, if nothing else is working, the patient can receive surgery where we place a small opening into the stomach or the abdominal wall to help relieve any pressure buildup that may be occurring. We also can do gastric electrical stimulation, which is very similar to how a pacemaker would work. So pretty much it's just a small battery operated device, and it's used to send mild electric pulses to the nerves in the stomach, just allowing for it to contract properly and push the food through into the small intestines. And this does help decrease nausea and vomiting long-term. So a few other things that can be done to just control gastroparesis would be changing our diet overall. So eating smaller meals definitely helps with that. Typically about 5 to 6 meals per day instead of the average 3. Chewing our food completely, eating cooked vegetables instead of raw or undercooked fruits and vegetables, eating foods or vegetables that are low in fiber and also low in fat. If you're having trouble swallowing, also pureeing your food or eating soups is a good option. Trying to drink plenty of water, doing some type of exercise after you're eating to just help with that digestion. So just like taking a walk, avoiding alcohol, smoking, or carbonated beverages, not laying down immediately after eating, and also taking multivitamins. So a few of the things that we definitely want to avoid if you have gastroparesis would be foods and beverages that are high in fat or fiber, foods that can't be chewed easily, carbonated or fizzy beverages, alcohol, fried foods, and fatty red meats. A good alternative would be just to consume our leaner or softer meats, just like chicken, your fish, your turkey, just because those are easier to digest. So gastroparesis can impact other illnesses, kind of like we briefly talked about earlier. Diabetes and gastroparesis can be very closely related. So if you have both of them, the first step would be to get the blood sugar levels controlled. So just make sure your diabetes is properly controlled. Just because hyperglycemia or having very high blood sugar can delay the emptying of food into our stomach and just make our symptoms worse overall. So if you do have both, your primary care physician is probably going to recommend taking your insulin more often if needed, changing the type of insulin you take, taking your insulin after meals instead of before, and also just checking your blood sugar levels often. And that's the end of my presentation, and I can take any questions.
This is going to sound like a strange question because we're always told that fiber is important. How do you balance out the lowering of fiber for the gastroparesis, but then keeping the fiber so that we don't have other issues? You know, it seems like that would be a hard balance to make, especially in this situation.
Mm-hmm. I feel like I don't believe it should be avoided completely, but I do feel like not consuming, I guess, the daily recommended amount of fiber for a healthy person or a person that doesn't have this issue. So I think that would just kind of vary depending on the person. I'm not sure about like an exact amount of fiber a person with gastroparesis would need to consume, but it would definitely need to be lower than the average amount.
I think you answered it appropriately, Brianna, because it depends. Some people with gastroparesis need as much fiber as a regular person because it depends upon how it has presented. If they have diarrhea caused by their gastroparesis, the fiber slows it down, which allows the food to get better absorbed, the nutrients to get better absorbed. But if they have a constipation aspect to their gastroparesis, that's where they might need to finesse their diet a little more. I think, Judy, that's probably the best way to look at it. Is gastroparesis is going to be very individualized.
Yeah, it sounds like it would be a hard, almost an individual hit and miss, trial and error, trying to find what would work and what doesn't work.
The few patients that I've seen with gastroparesis, that they need more individualized attention, it is, because they can have 6 ounces of coffee, for example, and they're fine. If they inadvertently pour themselves an extra ounce or they have extra caffeine, it becomes a mess and it can throw everything off, and it can take weeks for them to get back to be regulated again. And it can be very messy for some people with gastroparesis. Does anybody else have any questions, either here or on chat? Because I'm watching that as well. I think, Brianna, I'm trying to make sure I give time if anybody's typing something, that I'll let them type it, but I see none. Oh, we have one. They want to know why no sodas if you have gastroparesis. And I'm wondering if, to expand it further, Brianna, specifically, let's talk about carbonated beverages.
I honestly don't know the answer to this directly. I can look more into it, but my thought would just be having the excess of bubbles or carbonation in the stomach is just going to make your nausea, vomiting, or your bloating worse. Like the buildup of pressure in the stomach is what I'm thinking.
And sodas, depending upon if it's diet or not, could be the excess sugar or the artificial sweeteners. Both of those can alter either sugar in the soda, or some of the artificial sweeteners that are in sodas can alter how things move through your intestines, which could make it worse as well. I hope that answers your question. Sure. Yes. All right, then I see no more questions. So Brianna, thank you very much.
Thank you.